right, so this one's going to be really quick. Data plan for a cell phone. People spend 70 voice and data, 70, 80, 100, $120. You know, it's a necessity without even thinking about it. Healthcare. I just got my new healthcare, and you know, new year, and I'm also, some other things have changed and whatever. So my healthcare is now $193 a month. Now this is actually a bargain. I'm in California. I used to live in New York, and this was like, what, like 8 years ago, I think? I was paying over $300 a month. And that was for like pretty basic bare bones healthcare, which is what I have now, but it's cheaper out here in California. And this is my thing. Why is it okay for people to spend $100 a month on a cell phone plan so they can talk and they can get, you know, portable email and all that stuff when you can get a home phone for like $30 and you just don't have it where you go? Like, that's acceptable. That's, everybody's like, that's what we do in America, no problem. But healthcare, there are tons of people going without healthcare because somehow either it's acceptable for healthcare to be that expensive, or it's acceptable. I've known lots of people who, you know, have cell phone contracts, have home high-speed internet, but won't pay for healthcare. Freelancers who don't get it through their work, that kind of thing. Like, what kind of sense does that make? Why is that okay? Why in a country that's this rich, that has so many resources at our disposal, so much money, so many other resources, why doesn't everybody have healthcare? I know it's not that simple of a question. I know the easy answer is probably money, like education. You know, I did a video a couple days ago about, you know, working as a teacher in schools versus working in consumer tech, and a lot of people in the comments said, well, dude, the answer is money. Teaching doesn't, you know, generate money for the world. Even though it does, because without educated people, there wouldn't be, you know, innovations in industry. Similar thing, without healthy people, there wouldn't be all the advances in the world. But even to take it to a level kind of more concrete than that, if people were healthier, the amount of money and resources that we as a nation, as a world, would have to spend on healthcare would go down. The healthier people are, I mean, you get an airplane with 200 passengers. Everybody's healthy versus everybody's overweight, right? The amount of fuel you have to spend to fly from New York to Chicago will be down. And that's kind of a silly example, but you can quantify it like that with healthcare. You can quantify it like that with education if you want to, but that's not how people choose to do it. So my question to you, how many of you watching this right now don't have health insurance? And why? How many of you pay for your own health insurance? How much do you pay? How much do you pay for your cell phone? If you had to give one up, what would you give up? Right? And what can we do to make it so that, you know, if you can, I mean, seriously, if you can take this thing around with you and for $100 a month, you can talk all you want and get driving directions and email and internet and watch YouTube videos and pay your parking tickets online and all that stuff, why for $100 a month can't people get basic health care coverage so they can be as happy and healthy as those people right there in the photo? Where is it? Look at how happy and healthy they look. Everybody should be that happy and healthy.